today we are going to see a case study discussion on what are the different types of devices we have in the medical field, and we are going to discuss about each and what are the benefits it is giving to the patients and what are the parameters can be identified by the specific instrument we are going to see about it. Okay, can anyone start with that? Okay.
So I will talk about the pulse oximeter. So pulse oximeter is a very important device which is very small and affordable, and it is used by people who has asthma, and it was very popular during the COVID-19 because everybody depended on it. So pulse oximeter is basically used to detect two things. One is the saturation and oxygen saturation in the blood, which is also referred as SpO2. And then it is also used to detect the heartbeat rate. So first, the oxygen level in the blood. This pulse oximeter basically has two types of light. So one is the red light, and the other one is the infrared light. So this is allowed to pass through the fingers, or it is even used to clip onto the toes, fingers, and earlobe. So when it is attached to the body part, it allows these light to pass through them. And the main process is that that is the oxygen mixed blood absorbs light in a different manner, while the carbon dioxide or the less oxygen mixed blood takes absorbs this light in a different manner. So due to this, they'll analyze how much oxygen is saturated in the blood, which is the SpO2 saturation in the blood, will be set by the pulse oximeter. And the second one is basically, which is usually around 95% to 100% in normal cases. And then it is secondly it uses pulse detection, which is it takes in the heartbeat rate of a person, which is around 60 to 100 BPM, which is beats per minute. So it detects these two main things, and this is used in clinics, hospitals, and even at homes because of the small size and affordability.
Thank you. Next, I want to talk about the EEG, which is an electroencephalograph. So here it is not just a device; it's a device which is used to detect monitoring the brain activities. So this is not only used in healthcare; we can also use in daily life also. So first, the use of the EEG in daily life is for education. So in education, first if you have a headband with EEG which is related to IoT, we can link the IoT with the EEG in healthcare, so that we can detect the concentration level, and then we can do meditation level, so the focus of the subject will be easier. So also for the elder peoples, we can use this EEG for the and also for here EEG can send the brain waves to this. I can detect the brain waves, and also it helps in doing the like it can give like a focus. How we can detect the focus level, and meditation is like it sends the brain waves to this through this EEG, so that we can detect these levels. And also we can use in controlling the home devices, and also we can use it in physiotherapy, and also we can use this in wheelchairs, and also we can able to do in gaming apps also. In gamings we can use to select these options, like these elements in this app can be accessed through this EEG, and also we can use in healthcare for the doing the brain signals, and also these are also used in like for elderly people, like as I said, like they can also sleep cycles can be detected. In sleep cycle they can wear an EEG headbands. Because of this they can have an like a normal sleep cycle if they have an irregular one, and also they can have a sleep cycle app, so that in this EEG can be used to detect our sleep cycle and can be noticed, so that we can make our sleep cycles regular.
I'm here to talk about the blood pressure monitor. This is a very basic and small device which is used from small clinics to bigger hospitals and ICUs too, because this is the most basic thing which is required for every kind of patients. So in this, cuff is covered over the arm of the patient, and the pressure is detected, which this pressure refers to the diastolic and systolic pressure, which is the pressure exerted on the arteries in our bodies by the blood. So this can refer to the way the heart pumps, that is it may be hypertension, that is high BP, and lower BP, which is hypotension. So this device is used in ICUs, and even when we are going to take for heart treatments too, they basically start with BP testing. So this device may be used by even nurses and the doctors. It doesn't require much skill, and even it was found before years, and still now they are using it. It may be manual BP machine, or now
heart attacks and issues in the blood flow. The ECG is very useful and easily accessible and non-invasive method. The small sensors called electrodes, which are placed in chest, hand, and legs, face to find the electrical activity of the heart and blood flow. The ECG is very useful and reliable, which is done in a hospital, clinics, and even in ambulance. And nowadays, the small devices also calculate the blood flow and heart activities by using ECG. The ECG is producing the clinical information about how the heart works and the activity of the heart. Today, the main cause of death is one of the is heart failure. The ECG can predict and save the lives easily. Thank you.
As we all discussed, we came to know about what kind of different equipments we have in the hospital and what are the usage resources, what are the purpose it is used for, right? Thank you all for the